Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about the various abnormalities of the uterus for which a patient can come to us for consultation. The most common abnormalities we are going to discuss in today's lecture. So this will be a basically clinical lecture, and we are going to discuss about the clinical abnormalities for which the patient is coming to us. We are going to discuss three major abnormalities today. So let us start with the abnormalities of the uterus. Number one, the most common and the most important abnormality of the uterus for which the patient is coming to us is the uterine fibroids. So uterine fibroids are the most common growths for which the patient is coming to us for the urogenital consultation. Myomas of the uterus or the fibroids are basically benign tumors. These tumors can be single or multiple, and these projects from the surface as a swelling or swelling nodules, which are firm and irregular in outline. So uterine fibroids are basically myomas of the uterus, and these are benign tumors. So these are not malignant but benign tumors, and these may be single or multiple. These projects from the surface as the swelling or swelling nodules, which are firm and irregular in outline. These are occasionally a myoma projecting laterally and may be confused with an ovarian tumor. A nodule projecting posteriorly can be mistaken for a retroflexed uterus. The submucous myoma projects towards the endometrial cavity. So occasionally these myomas, these projecting laterally, may be confused with the ovarian tumor. A nodule projecting posteriorly can be mistaken for a retroflexed uterus. Submucous myoma project towards the endometrial cavity. So these are about uterine fibroids. What does uterine fibroid presents with? So a patient with uterine fibroid most commonly presents with menorrhagia, too early menses, menses lasting for too long duration, and dysmenorrhea. The next important complaint for which the patient usually comes, the uterine complaint, is the uterine prolapse. What is uterine prolapse? Uterine prolapse of the uterus that occurs due to the weakness of the pelvic floor muscles. So if the muscles of the pelvic floor becomes weakened, then it results in the uterine prolapse and is often associated with cystocele and rectocele. So it is associated with cystocele and rectocele. In progressive stages, the uterus becomes retroverted and descends down into the vaginal canal from outside. The prolapse can be of different degrees: first degree, second degree, third degree prolapse. And depending upon the prolapse, the treatment has to be decided. So this is another very important disease, the prolapse of uterus, that occurs mostly due to the pelvic floor muscle weakness and is associated with cystocele and rectocele. And in the progressive stages, the uterus becomes retroverted and descends down to the vaginal canal and the outside. Third is the retroversion of the uterus. So retroversion of uterus refers to the falling or the tilting backwards of the entire uterus. If the uterus falls backwards or becomes tilted, then it is known as the retroversion of the uterus. It occurs normally 1 in 5 women. In the mild cases, the pelvic examination shows a cervix that faces upwards, and uterus cannot be felt by manual examination. So while performing a bimanual examination, the uterus cannot be fed. So retroversion of the uterus is basically falling backward of the entire uterus, occurring normally in 1 out of 5 women. In mild cases, pelvic examination shows cervix that faces forwards, and uterus cannot be felt by manual examination. So these are the basic 3 diseases for which the patient usually comes to us. I will again repeat these 3 diseases. Number 1, uterine fibroid. These are the benign tumors that can be single or multiple, that projects from the surface as a swelling or swelling nodules. These can be firm and irregular in outline. These are occasionally myoma, projecting laterally, may be confused with an ovarian tumor. A nodule projecting posteriorly may be mistaken for a retroflexed uterus. Some mucous myoma projects towards endometrial cavity. Next is the uterine prolapse. That is, the prolapse of the uterus occurs due to weakness of the pelvic floor muscles. It is often associated with cystocele and vectocele. In progressive stages, the uterus becomes retroverted and descends down into the vaginal canal to the outside. Third is the uterine prolapse. That is, the prolapse of the uterus occurs due to weakness of the pelvic floor muscles and often associated with cystocele and vectocele. In progressive stages, the uterus becomes retroverted and descends down into the vaginal canal to the outside. Third one is the retroversion of the uterus. It refers to falling or tilting backward of the entire uterus. Occurs normally in 1 out of 5 women. In mild cases, pelvic examination shows cervix that faces forwards and uterus that cannot be felt by bimanual examination. So this is all about the abnormalities of the uterus. In the next lecture, we are going to discuss about the speculum examination of the vagina, or the internal examination by vaginal speculum. So this was all for today. This session was powered by Digital Version 2.0, JAYOTI Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.